And naisip lang namin na paano kung hindi kami handa para magbayad ng ganito kalaki. Kasi we prepared for a different amount. Hello everyone, we are back with another video. I know it's been a while since our last entry, pero in light of recent events, I just thought of making this video anyway in order to help other fur parents out there who might be going through the same thing that, we've been through with Inday. So, yeah, recently, Inday was diagnosed with urinary stones. How did we find out about that? One day, we noticed na mas madalas siya magwiwi, parang kakawiwi lang niya, tapos lalabas na naman siya agad. And then we also noticed that whenever she would pee, there are times na merong small amount of blood na kasama ng wiwi niya. And there are times na talagang bright red yung blood. So the next day, we had her check sa vet lane kay Doc Eden. We had an idea na it might be, urinary stones or something to do with the kidney kasi wala lang matres sa Inday. So wala, X na yung part na baka period lang niya yun. So when we visited the next day sa vet namin, Doc Eden confirmed na it is in fact, urinary stones kasi she palpated Inday's tummy and she was able to palpate yung small stones sa may tiyan ni Inday, sa may kidney area ni Inday, ganon. So, but of course, in order to confirm that, yung parang pinaka-concrete diagnostic test would be doing an x-ray. So, she referred us to Animal House. And when we got there, yun nga, nakita na nga namin. I'm gonna insert the picture here, yung x-ray ni Inday. So, may isang kumpol ng stones sa part na to. Yan. And, nung kinausap kami ng vet, of course, their first recommendation would be cystotomy. The surgical removal of yung urinary stones to get rid of it. Pero since Inday just, underwent a major surgery just a year before, parang naisip naman namin, grabe, opera na naman si Inday. Nakakaawa naman. We chose yung second option, which is we are going to attempt to flush yung urinary stones niya by medications and by strict diet. We were advised na we're gonna try to do it for 3 months. Kasi, and actually, even at 3 months, baka very minimal lang yung makita namin na improvement. Pero we're still gonna try. We ended up doing yung second option. We went home and she was prescribed with antibiotics, urinary acidifiers, yung renal care syrup, and she was also on strict diet, which is yung dog food niya is Royal Canin Urinary SO. So, this kind of dog food is specifically for cases like this dahil yung ingredients niya also helps, kind of flush yung urinary stones. So, yeah, we did that for 3 months. Siguro mga 2 weeks before, end of 3 months, we started noticing na wala na yung blood sa wiwi ni Inday. Normal pa rin naman yung amount ng wiwi niya. But sabihin, pinaka-importante doon, wala lang kami nakikitang trace ng blood sa wiwi ni Inday. So we were very hopeful, we were very optimistic na maybe it's really working, So when we visited vet lane again, we visited Doc Eden. Nung kinapa niya pa lang, sabi niya, parang wala masyadong improvement. The amount of stones that were there before, it's almost the same. So she said na, of course, to confirm this, we're gonna need to go to do another x-ray to be sure. And so yeah, we rushed again sa Animal House to have another x-ray done. So that's 3 months apart. This is the second x-ray ni Inday. I'm gonna insert yung picture. And you would see it's almost exactly the same amount. It's just a little scattered. So there was almost no improvement. And we were told nung second vet na nakausap namin, si Doc Karen, second vet from Animal House, si Doc Karen, we were told na it's really advisable for us to go do the surgery na while Inday still has great kidney function. Kasi they also did another test to see, parang clearance test niya if she is actually a candidate for cystotomy to undergo surgery. They're gonna be under, general anesthesia, and it's important for the body to be able to flush it out then after. So yeah, she's a candidate still. She has good kidney function. It's just that she has urinary stones. So imbes na antayin namin na bumagsak pa yung kidney function ni Inday, because of this, it might as well do the surgery already para just to get rid of it na. And also, what's great about Doc Karen is that hindi lang niya kami binigyan ng status ng, ng X-ray, relating to the urinary stones, but she also gave us an overall status ng health ni Inday. She also mentioned na Inday, being a senior baby that she is, she also has arthritis already, and we should start thinking about giving her joint medication na rin. So parang okay, that's another thing we have to think about. Pero sure, we can go do that after her surgery. But yeah, it's great na at least hindi lang yun yung tinitingnan ng vet, na she's really looking out for the entire, for the overall health ng fur baby niya. So yeah. So on that day, we decided na we're gonna go ahead and do the surgery now. We're gonna leave Inday sa animal house, and they're gonna do the surgery that same day. After we left, after their business hours, they immediately started yung surgery, and it didn't take more than an hour. After that, they texted us yung status ni Inday. Right after the surgery, they said that the surgery was a success and that Inday was just a little groggy, of course, dahil sa anesthesia. Overall, the surgery was a success. The stones were removed. We're just gonna be waiting for her to, recover. We were also advised na after ng surgery, she needs to stay for around 3 days for her to be closely monitored by the staff. If anything should happen, at least walang problema, the medical staff is there. We were so worried before Inday, went under. But after getting that text message, we felt, an extreme sense of relief. And kinabukasan, we visited. Yung visiting hours nila is around 1 to 4 p.m. We visited Inday the next day. Pero before we visited, yung morning status update kay Inday, they said na Inday wasn't eating, medyo matamlay siya. Although responsive si Inday, when you call her, she would, lumiliban siya. Pero hindi pa siya yung malakas kumain, which is actually normal pa rin naman daw after ng surgery. And maybe also it has something to do with the environment she's in, that she might be a little stressed kasi we're not there. She's with, strangers or dogs, and dogs that she doesn't know, of course. So yeah, but when we visited, nakakagulat si Inday. Nagpapakitang gila si Inday. So, when we visited, parang all of a sudden, biglang ang sigla-sigla na ni Inday. Tapos biglang gusto niya kumain. Inubos niya isang buong bowl ng dog food niya doon. So, parang the staff were very happy na Inday was, really up and about na. Pero when we left, nireport sa amin ng staff ng animal house na when we're not there, she really doesn't want to eat. So they would end up force feeding her through a syringe. So yeah, and also on the first day, ano ba itsura ni Inday? Naka-e-collar siya to prevent her from, accidentally taking off yung IV niya. Naka-IV din siya for her, fluids. And naka-catheter din si Inday. We saw that the bag still has a little bit of blood sa urine niya, which is also expected. So, on the second day, we visited. Yun na naman siya. Kumakain naman siya kapag nandun kami. We also noticed na yung urine niya, wala nang trace ng blood. So, that's good news. She was still on a catheter. So, when I mentioned that kay Doc Karen, she said na it's time to take out yung catheter and then observe her, trying to pee on her own. Under observation lang siya until tomorrow. And then, yung the third day, we decided na even if hindi pa recommended, halimbawa kung sakali lang hindi pa recommended, we are really gonna bring Inday home already, even if we needed to sign a waiver. Kasi we just felt na if she's at home, she would be able to recover faster. Knowing na she's eating when we're around, and basta siguro just less stress overall. When we told that naman sa vet, they understood naman, although they really wanted to have Inday stay for maybe 1 or 2 more days. Kasi yung wiwi niya, when she was peeing on her own, meron pang konting-konting amount ng blood na nakikita. But they said naman na it was expected still. At least not more than a week after ng surgery. That's still expected. Okay, sige, since kumakain naman siya kasama pagkasama kayo and everything else looks great, yung wound niya, walang discharge, it looks healthy. So, we just need to be able to closely monitor yung amount ng wiwi ni Inday and also yung amount ng blood na kasama ng wiwi na Inday. It should be tapering off, not, not increasing in amount. Then we should be fine. And they just gave us yung medications na lang. Okay, so punta naman tayo sa entire cost ng surgery, her stay there, medications, equipment used, everything. So, if you saw yung video, you would already have an idea how much this is. So, when we initially asked kung magkano yung quote nila, parang rough estimate nila for the entire surgery, they said that it would be around 12 to 13,000. Pero wala pa dun yung gamot, wala pa dun yung stay niya, yung confinement days niya, ganun. So, parang naisip namin, okay, so 12,000, sige, kaya naman pag-ipunan. Maybe mas magmamahal pa ng a little bit more kasi syempre wala pa yung days ng stay niya, yung gamot, yung pagkain, ganyan. Pero I don't think naman it's gonna, go over 20,000. Kasi yung stay niya, it's 950 per day on the 950 on the first day and then 700 for the days na nandun si Inday. So, naisip namin, 1,400 tapos 950. So, maybe, again, not greater than 20,000. Pero when we had her discharged, medyo nagulat yung husband ko dun sa amount na binayaran namin in total kasi it amounted to 26,305 pesos. 26,305 pesos. Medyo malayo ang talon niya from 13,000 to 26,000. Medyo malayo talaga. And naisip lang namin na paano kung hindi kami handa para magbayad ng ganito kalaki. Kasi we prepared for a different amount. But looking at it, it seemed like malalaki talaga yung may mga gamot dito na worth 2,400, 1,300. Tapos meron din yung expenses for yung medical equipment na ginamit sa kanya, yung urinary catheter, yung bag, tapos yung diet din niya. So, it just amounted to that. But anyway, so we just didn't expect na ganun kalaki yung tatalo ng amount ng entire surgery and stay niya. But yeah, Inday was well taken care of and we feel naman na as long as she's better, that's really what's important. Okay, punta naman tayo sa what caused this to happen. What are the causes of your fur babies na having urinary stones? When we asked this sa different vets na nakausap din namin kay Doc Karen, kay Doc Eden, they said na una sa lahat, this is something that does not happen overnight. Kasi I was also thinking na baka dahil sa sobrang na-excite ako sa mga treats na pinapadala sa amin ng mga local shops. So I kept on giving them more treats than they should really have in a day. So I was kind of guilty about that. Pero Doc Eden said din naman na it's not something that develops overnight. It's something na to do with their diet and their food within the past couple of years. Kimmy here is actually older than Inday by 1 year. Pero si Kimmy is, wala siyang problema sa buhay. Chill lang siya. Kimmy is really yung fur baby ng husband ko ever since 2009. Yan. Si Inday na in-adopt namin siya last 2018. Feeling din namin, baka dahil sa diet ni Inday, dahil may times na she was eating table food, ganyan. Eating table food, chunky ni Inday. Yung talagang result, naging chunky si Inday ng bonggang-bongga dahil in-enjoy niya yung mga kaulaman. So, first of all, yung diet. Second, not enough water intake. And then third, Doc Eden said that there are just certain dogs that are more prone to it. Smaller breeds din. Yeah. So, those are the things that you need to remember. You really need to look for good quality dog food, dog kibble. Other people are feeding their fur babies raw food. Okay, sorry, baka masyadong mahaba ng video na ito. Let's just end it at that. I hope that this video helps and gives you an idea, how to prevent this from happening to your fur babies and what to expect if your fur babies already has been diagnosed with this, and how you can prepare. Maybe on the next video, I can talk about what kind of dog food would be best, because that's what we're doing now for purchasing, yung dog food nila. We're just really looking into, ingredients and all that. As I've, searched YouTube for how to look at which dog food is best for your fur babies, medyo mas may natutunan pa ako. That's gonna be a topic for a different time kasi it's an entirely different, topic. So, maganda mag-dwell into that with another video. I'm gonna end this video right here, and I hope that this video has helped you. And thank you for watching. See you on our next vlog. Bye-bye!
Sharing with you some Inday clips after she got home. Ayan, of course, balik lang uli sa hilata. And this is what Inday looks like when she's awake. Obviously, nawawala yung baba niya dahil sa ginawa sa kanya sa animal house. Uuwi na lang, tinapyasan pa ng baba. Kakaloka. Ayan na, si Inday. Disappointed. Nawala yung baba niya. Bukod sa urinary stones, pati yung baba daw niya, ba't nawala? Oo na, wait lang. Grabe naman to. Ito na. Ay, sus. Okay. Ay, sus. Breakfast. Inday! Are you ready? Shh, wait lang. Shh, wait lang. Alam mo, pwesto mo. Saan ka? Dito ka sa likod. Ito ka. Inday. Come here. Come here, Inday. Bilis ako. Shh, wait lang. Wait. Oo, Diyos ko po. Ayan. Ayan sa'yo. Wait lang, ah. Okay. Siyempre, ang diet ni Inday Bingbing girl. Wait. Oh, Diyos ko po. Inday, wait lang. Kumalma ka dyan. Ha? Wait. Buka. Wait. Iba talaga. Wait. Okay. Wait. Okay, come. Nanantay mo. Chewy. Finish. Come on. Come. Good boy. Ay. Ano yun, guys? Ubus na. Ang bilis. Natapon na. Nasaan ang baba mo? Sabi mo sa akin. Nasaan ang baba mo, baby girl? Inom ka na tubig. Drink water. Sa loob, baby girl. Sa loob. Drink water. Good girl.